I'm Dr. Ray Fowler. I'm a professor of emergency medicine at the University of Texas Southwestern Medical Center in Dallas. It is very clear that the way we have done business for years as far as the management of cervical spine injuries or potential injuries must be revisited by those of us who are involved in the management of EMS systems. One important thing to realize is the fact that most people with cervical spine injuries apparently don't have fractures. It's sort of like, think for a moment about an ankle sprain. When someone comes and sees us, they've twisted their ankle. X-rays are usually normal, but it's swollen and blue, as you know. And the reason for that is that the ligaments have been injured. It turns out that cervical spine injuries are similar in that most injuries that we see are ligamentous injuries as opposed to fractures. It also turns out through recent work that's been done, especially in Houston, Texas, in the EMS system and trauma network there, that through studying cadaver labs and three-dimensional computed tomography reconstructions, it has been shown that anything that pulls on the neck in someone with a ligamentous cervical spine injury has the potential to distract the neck, and that's a word that you need to know. Distraction means to make longer. If we make the neck longer in the setting of a ligament injury, that has a distinct risk of harming the spinal cord. In the living, the spinal cord has the consistency of cold jelly, and it does not tolerate it being stretched at all. And thus, we now need to strongly consider a new paradigm. No longer, we should never do cervical traction unless ordered by a specialist in the field who determines that traction is what is required. For example, if to relocate a jumped facet, for example, might require very carefully applied traction in the operating room. But in the field, in EMS, and really in the ER as well, we should not be pulling on necks. Cervical traction as a term needs to go away. And the classic term of cervical immobilization commonly uses collars that, when applied, actually make the neck a little bit longer. It seems clear that we should not be doing that either. We propose, and it seems to be that this is the way the industry is going, that instead we use the term cervical splinting. A cervical splint, then, just as if it were a splint for a broken arm or a splint for a severely sprained ankle, is a device that will immobilize the neck without applying traction or distracting, as we used the term a few minutes ago. Therefore, I want to ask you and strongly urge you to think about the fact that the new paradigm is cervical splinting. So as you go forward and begin to price out the devices that you'll be purchasing for your EMS system, make sure and be certain that you examine very carefully the devices that you purchase to make sure that they truly act as cervical splints.